Remembrance Day, Canadians from coast to coast honor those who gave up their lives and continue to serve our country. But many of those veterans continue to deal with the fallouts of wars and service for years to come. This year, it seems the challenges are being compounded because of COVID-19. Veterans organizations say the pandemic is taking a financial, emotional, and physical toll on those already struggling from service-related injuries and trauma.
We're starting to see more and more people reaching out, asking us for help, asking to take our programs, particularly in the month of November. It's a difficult time of year for many veterans.
Oliver Thorne at the Veterans Transition Network says those requests are also becoming more urgent. The Veterans Transition Network specializes in mental health care and has changed its programming to account for safety during the COVID-19 pandemic. But the move has come with its own challenges.
You know, we have a network of psychologists and counselors who work with us to deliver our programs across the country. Many of them had to close their private practices temporarily. All of them saw reductions in the number of people coming to access their services.
Demand for the online programs at Veterans Transition Network has so far been high, with 400 veterans on a wait list. But with all the uncertainty and added stress the pandemic has brought on, several former officers and their families are also increasingly asking for help from Wounded Warriors Canada.
Specifically, our group-based programs for family members. So spousal, couples-based programs, programs for spouses, and programs for kids. The demand for those services just went through the roof. And that's a result of the downward pressure that COVID-19 has placed on the individual affected member first, and by extension, of course, the family.
Concerns have been raised about disabled veterans not being able to get the physiotherapy or rehabilitation they need for physical injuries because of COVID-19, and also about former service members with post-traumatic stress disorder falling through the cracks without in-person therapy and support. Recent statistics show in the last 5 years, the number of veterans with PTSD receiving disability benefits has increased by 69%, and many are not getting timely help. The Veterans Affairs Department currently facing a backlog of 45,000 claims. That backlog has left many injured ex-soldiers waiting sometimes years to see if they qualify for support, and has been identified by advocates and the Veterans Ombudsman as a major source of stress and frustration.
Clearly, we have a lot of work to do when it comes to these disability benefit claims. To me, to us anyways, that's a massive barrier to care.
I think the silver lining there, if there is any, is that people are coming forward. It's a very strengths-based culture. It is a culture that is somewhat resistant to help seeking. So it's really good to see that more people are stepping forward, asking for that support so they can get on the road to recovery.
The Liberal government in September promised $20 million for veteran support groups after the pandemic took a toll on the finances of veterans organizations such as the Royal Canadian Legion, forcing them to close branches across the country. But that amount falls short of the $30 million the Legion had requested. In Vancouver, Kier Junos, City News.